Okay, I see my screen. Hello, good morning, good afternoon. Good morning, good afternoon. If you're here for the drop-in for the risk-based water quality monitoring and management course, week 2, you're in the right place. Um, Welcome. So as you're joining, as we're still getting to know each other, if you'd like to type in the chat your name and where you're calling in from, and if you want to add what you do as well, great. But as people join, please do present yourself in the chat. Got myself, Tom, Jessica, and Bettina here on the call. And Jessica, I understand we have an hour scheduled, don't we, for this call? And we really
Yes.
want this to be an opportunity for you to come with any questions. So we're now on week 2 of the course. I'll pop up the calendar just to remind you. So if you've been able to get into the course and start going through the modules, perhaps you're already into week 2 in unit 2. Unit 2 has 2 parts, part A and part B. Today, we're going to be recapping part A, which is about conducting sanitary inspections. Conducting sanitary inspections. That's what we'll be looking at today. But any questions about the course, the platform, here's the chance, here's the time to raise those questions. As we wait for others to join, so please do type your name, where you're dialing in from in the chat. I can see we've got let's have a look who we've got on the call already. Hi, Linda in Ghana. Welcome. And Rafael, I think I recognize your name from Honduras. Bienvenidos. And just to warm us up, as we're going to be doing some critical thinking today, um, I've got a little game exercise. And we're also going to try out a functionality on Teams that we attempted last week. So I don't know if you ever played this as a kid. Bettina, Jessica, Rafael, Linda, did you play this as a kid? Thumbs up. Yep. Spot the difference. Jessica, can you explain to me how this works?
So what I remember as a child is you compare the two images and you're looking for what's different between the two images.
Exactly. So this is actually just off the back of a cereal box. Other cereals are available. And left-hand side, right-hand side. So there's some differences on the right-hand side. Now, I'd like you to either type in the chat, unmute and speak, shout out what are the differences between the image on the left and the images on the right. Yes, Linda, did you want to jump in? No worries if you don't. The other thing you can do that we're going to try with, you should be able to see a little pen on your left-hand side of the screen. If you click on that, you'll open up this palette, which will allow you to click on the draw function. And from that, you can draw onto the screen like so. So if you have got that function, if you can see that function on your laptop, if you're dialing in the computer, you can also annotate our screens. We're keen to get as much interaction as we can today. So have a go with that. It should pop up. Hopefully I've not confused it by having it on my screen there. But it should pop up on your left-hand side when you click on this little pen, this green pen. So have a go with that as people are joining and see if you can spot the differences. Um, so you should see this bar pop up on the left if you click on the green pen if you want to annotate the slide. So feel free to draw. Yes, somebody's found something. That's one. Great. There's 10. Can we get all 10 as people join? Can we get all 10? Someone's found the missing face on the heart. Can you see any more? Feel free to type in the chat, shout out. Um, so we're just warming up our brains because I don't know if anyone's spotted already the link between this game and what we're discussing today, sanitary inspections. There is a link, I think. Um, Welcome. We're just playing a game to start to warm ourselves up for this session. We're looking at sanitary inspections. Welcome. Please do say hi in the chat. Tell us your name, where you're calling from. If you'd like to, you can add your role, what you're involved in. We're looking at sanitary inspections today. So if you're looking for it's a very long acronym, Jessica, for this course, isn't it? The risk-based. Very important. But because that's so complex, there's so much to it. Um, we were looking for differences. Someone else has found a difference. Yes. We've got two. There are 10 in total. Okay, yes, the bowl is different. Is it just one thing that's different with the bowl, or are there two things different with the bowl? That's one, two, three. I can see four circled. There's a missing C up here. See if you can follow along and see them. Here it is. I'm also going to try my little green pen. Hope you're getting involved, Bettina and Jessica, as well. Um, we've got one, two, three, four, five hats. The hat's got a band, very good, that's missing on the right-hand side. That's five. I think there's another. Yes, what's that last one you did, Bettina? What's that? I can't see that difference. What's that? You just highlighted one, Bettina, I think. A white
It's
circle.
the length of the ear.
The length of the ear. Wow, I did not see that. Very good. The length of the ear. Yes, the magic wand is disappeared by magic in the second image. One of the lamb has fire, but the other one doesn't. The lamb, where's the lamb, 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 lamb? Oh, like the, what's it called? Oh, is it not a sheep? Kind of like a sheep. I think it's a rabbit, actually. I think it's a rabbit. Yes, the bold doesn't have food in it. The other one does. Very good. So why are we playing this game? Jessica, maybe you want to bring some, or Bettina, bring some sanity. Why do you think we're doing this exercise as a warm-up?
Well, I think it's very important to pay very close attention here as well as when you're doing center inspections, and especially so in center inspections because it may be a site you see very regularly, so you might overlook little details that might have changed, but it's those little details that really count.
Thank you, Bettina. Spot on, exactly. So, like you say, you might be very familiar. I've been staring at this image whilst I've had my breakfast for the last few weeks, and I didn't notice the longer length of ear, which Bettina picked up on straight away. So, goes to show. So, we're talking about sanitary inspections today. If you've just joined us, a reminder. Now, I'm going to see if I can I remove all the drawings? Let's see. Does anybody know how to do that? Clear, clear all drawings. Yes. So we've stopped that drawing exercise for now. Thank you for getting involved. Please do type in the chat, say hello if you're just joining, your name, where you're calling in from, and if you'd like your role. So we're talking about sanitary inspections today, but can somebody tell me what is a sanitary inspection? We're just going to start off with a couple of definitions before we do kind of some practice. And also, like I say, this is a chance to ask questions. See, Linda, you're still very much into the exercise from before, which is great. I don't know if we've got them all. I think we had pretty much all of the 10, but what is a sanitary inspection? So have a think. What is a sanitary inspection? How would you describe it in your own words? So if you'd like to take the mic, you can raise your hand with the Zoom function, or if you'd like to type in the chat, please do. What is a sanitary inspection? How would you describe it to a colleague, to a team member, to somebody you meet on the street? Oh, am I still going? Thumbs up, Jessica, I'm still on the call. Good, I just had
Yep.
a message come up from Zoom. So what is a sanitary inspection? What is a sanitary inspection? What would be your definition for a sanitary inspection? I was looking up the word sanitary, and apparently it comes from, don't know if you know this, Jessica, the Latin. If you know your Latin, which is kind of a root for many European languages. The Latin, I think it's like sanitia, which is kind of like health. So it's like sanitary kind of means healthy, from what I understand. So what do we mean by sanitary inspection? If you have an idea, you can raise your hand with the Zoom function or type in the chat. Um, Bettina, I can show the definition I have. I think this comes right out of the course. Do you think, if I put this up on the screen, Bettina, is there anything missing? Would you say there's anything missing from this description? So if you've joining, we're looking at sanitary inspections and we're just looking at the definition. Is anything missing, do you think, Bettina, from this definition, or Jessica, or anybody else? Do you think there's anything that you would add to help describe to a friend, colleague, a stranger you meet in the street, what is a sanitary inspection?
I think actually it's a very, very good comprehensive definition, and I've never been asked to describe it in my own words before, so I'm
New
glad you
challenge.
you showed the official definition. Um, I think it's what might be missing, not because the definition is wrong or incomplete, but to give some context, is the overall goal to reach wholesome water, safe water in the end. So that the reason why this sanitary inspection is done is to have a good environment in which safe drinking water can be produced by avoiding the risk factors that may lead to contamination. But other than that, I think it's a good definition for sure.
Thank you, Bettina. Yes, exactly. It's good to frame this within, we're looking at water supply. Mostly, I think we're looking at rural water supply systems. And I think the WHO guidance that we've been referring to in this course, the guidance is mostly, biased towards that. So yes, important to see this as a tool within the bigger scheme of checking water quality. Jessica, my little cursor is doing a little funny spin at the moment, so I might not be able to move along. If that happens, then I may ask you to jump in the next bit, but I think we can.
Okay.
So want to find
Wait,
out.
I'm
Oh,
going to
it's
say
changed.
we have one hand up right now.
Oh, fantastic.
Tom, your video
I
is
missed
frozen
that.
as well, so it might help if you maybe just take your video off and
Oh,
maybe
I'm
that
gonna
will help.
try. I think my
But
Zoom is having problems, but I can change you can hear me, right?
yes, we can hear
You can
you.
hear me, I can change the screen, but I can't
Yeah,
do much within Zoom beyond that. So if there are
no worries.
hands raised, please do pick them up and
Yes, Napoleon, I see your hand raised.
hi Napoleon. Yes, did you want to add something to the definition of sanitary inspections?
Oh, his hand went down. So Napoleon, if
No
you want to
problem.
share, you're welcome to, but
Welcome to share Napoleon if you want to, or type in the chat. I'm
There
going
is
to
another
stop.
comment in the chat.
Oh, fantastic. Yeah, my Zoom is
Saying
just
preventive
flat.
risk assessment that looks for problems before people get sick. Sanitary inspection focuses on observing conditions and practices before water becomes contaminated. I think that's very good and important aspects as well, the preventive aspect.
Exactly. Thank you. Yes, we're with a sanitary inspection, we can spot things that might lead to contamination before it happens. So you can see this here on the right hand side. This is an example from the WHO guidance of a which one is this? Does anybody know? I think I've got access. I think my Zoom is also sorted out now, so I can see people's comments again. Um, this is definitely a hand pump. I'm not sure if it was the dug well or the tube well. Oh, we can see number 4. It's the dug well. Um, thank you, Linda, for adding your comment in the chat. And Edith, welcome. Yes, assess the potential risks that can contaminate the water supply system. Super. Can I ask in our group, have you already done a sanitary inspection at a site or maybe at home in your community? If you have, can you raise your hand with the Zoom function or respond as you like? There's another way to respond, isn't there? There's a response button, react. React or raise your hand if you have already done a sanitary inspection in your work or in your home or in your community. Great, thank you, Bettina. Have you already done a sanitary inspection? Let's have an idea of how many people already have experience doing it. Thank you. Uh, I don't want to pronounce your name incorrectly, Tiraveshi. Thank you. And maybe as you go through this course, you'll realize that you have been doing this, but you just didn't know that it was called a sanitary inspection. Yes, Edith, thank you. So for some of us, it looks like this is still something new, which is just great. Like we're saying with the game at the start, new perspectives are really helpful when you start doing this again and again and again. Having new perspective is really helpful. Thank you for putting in the chat. Yep, great. So real mixture of people who have, and for some who this is new, which is great. Now, please do keep responding to this question: have we already done a sanitary inspection? Then the World Health Organization, Bettina or Jessica, do you know how long the document has been available, these sanitary inspections? How long have they been in print? How long have they been available to us? Even if you have an idea from the documentation. Yes, Bettina.
Well, the new ones, I think, since 2024.
Great.
but there have been sanitary inspections around before that. So there was an initial version, a previous version of the guidelines for drinking water quality in small systems from 1997, and sanitary inspections were already an aspect flagged there. But now with the new guidelines for drinking water quality for small systems, combined with this sanitary inspection package, that all has been redone in a very nice way, I think. And I think it was early 2024 that they came out.
Great. So thank you, Bettina. So sanitary inspections, they're not new, been around for 30 years. Not as well, or perhaps longer than that, Bettina, but 30 years we're aware of them being referenced and used. And then recently, just recently, these new revised, and they look very smart. Don't know if you've already had a chance to go through them. Um, so just as another little exercise, the WHO have produced 13 standard templates for different parts of the water supply system, different infrastructure, different kind of inspection points, different points where you would want to conduct a sanitary inspection. Can we name all 13? Can we name all 13? So I'm not expecting you to give the number. Just give me, you can either type in the chat or unmute and speak an infrastructure, and we'll see if we can pick up all 13. It's a bit like the spot the difference, this one. Can you deep borehole? Deep borehole. Now, maybe I should ask Bettina which number that is, but I won't. Deep borehole, very good. I'd say that's number 5. Is that right? Let's find out if it is. Oh, has it worked? Oh, hang on. Sorry about this. Yes, deep borehole number 5. That's the deep boreholes, isn't it, Bettina? What else? What other infrastructure do we have? Sorry, Napoleon, that you're having troubles with your access. How quick is a sanitary inspection? That's a good question. As we're looking at this exercise, Bettina, do you want to just speak into like how long should we spend doing a sanitary inspection? Or how long is a
So
piece of string? I don't know.
Yeah, well, it really does depend. It depends also if you can already, once you spotted risk factors, take immediate action to address that. Um, it's really how long is a piece of string, to be honest. It's as long as it takes to identify if all risk factors have been assessed, and if you're not just on your own, but several people, as long as it takes to discuss whether a risk factor is present or not, because there may be different opinions on that. Is this a crack in the infrastructure or not? How far away is the sanitary facility in the area around the borehole, etc. So these are questions that might take some discussion, especially with the distances, if we really want to measure them, how far any other potentially contaminating activity is away. That takes a bit longer. The weather conditions may be challenging. So as long as it takes, but they should be fairly quick, to be honest. If you're just looking at the infrastructure and the surrounding areas, it doesn't take a lot of reading. It doesn't take a lot of walking long distances in the catchment, but it's really on-site fact finding. So, as generic as that sounds, not too long.
I
Very
want
good.
to,
Yeah.
thanks,
Yes,
Bettina.
Jessica, please jump in.
I just want to key in on something in Napoleon's question just to make sure we catch it. It looks like he
Please
might
do.
be asking about, we've used the word rapid in the definition. So I believe he's asking, even if it's going to be rapid or quick, how do we make sure we notice everything that we should? So he's asking, how do
Mm.
we notice some things that require critical, like to look at as being critical? So it's a rapid assessment, but we also need to be thorough. So any tips for making sure we catch everything that we need to?
Bettina, if you like. Good. Thank you for clarifying the question, Jessica. So how do we make sure we pick up on the most critical things when perhaps we're stretched for time? So I know with these guidelines, there are templates with checklists. So it's really helpful to give us a reference of, I guess people have spent a lot of time studying and thinking through, okay, what are the key things people should be looking at? But would you have any other recommendations, Bettina, on how to prioritize what you look at? I'm just going to jump to an example of what the checklist looks like. Hang on a sec. I should get to
Well,
it.
I think you do have the checklist of questions, and the key is to make sure you, sorry,
Okay.
um,
So here's an
that
example
you
for
that you answer every single one of those questions. Sorry, worst moment ever.
no
Um,
problem.
and that you also, if you do the sensory inspections regularly, annually or every few months or however often, that you still every time take the time to have a look at the question and not just think, well, we ticked no last time, so it's going to be no this time. Um, have a critical look at the condition of the infrastructure, have a critical look at every single question. And I think it's a great tool because it also describes in very much detail what you should look at and what would be the condition you're looking for that could be critical. So it really takes you step by step through this assessment. And I think if you carefully read this and carefully answer the questions, then that should help in exactly avoiding things being overlooked.
Yeah, so that's right. So the guiding questions are really helpful to draw our attention to what is the most important things to be looking at, and how can we zoom in on the issues which are the most critical? Well, perhaps it's with practice and then starting to see the links between these risk factors and contamination that will allow us to then see more quickly, more rapidly, okay, what are the most pressing issues that we should deal with straight away? Thank you, Bettina. Um, in the chat, thank you, Linda. I noticed you've picked up on a couple more of those different infrastructure. So going to jump back to that slide. And anyone else like to add anything? We've got three so far. A dug well with a hand pump, which is top left. Number two, dug well with a windlass. Number five, a deep borehole. Can anyone else think of any other key water supply infrastructure that we want to, well, there is, for which WHO does have a standard template, protected spring. Thank you, Celio. Let's see where that is. All numbers. I think that is number three. Is that right, Bettina? Let's see. Yes, it is. Thank you. What else? So you might see now that there's a trend here, solar powered water system. So I guess that makes me think, thank you, Francine, of number five, the borehole where we've got a powered system. So I think that's included in number five. Good one to spot. You may notice that the numbers are going from one, the source, and through the supply system. So we're picking up the sources. What else in the system do we need to be inspecting beyond the source? I appreciate for some systems, the hand pump, the well, the spring might just have a single point to its whole system. But what else in a maybe a more complex system? What other infrastructure do we have? Jessica, Bettina, can you think of any else that spring to mind? Spring to mind. Oh, pipeline. Thank you, Nelson.
Yeah, that's exactly the next step. So it starts with the abstraction, of course, and that's where what a lot of these sanitary inspections are about. But it goes all the way to also distribution, storage, and if anything like that is included, also household practices, safe storage practices in the home, because you really don't want to stop at making sure that you abstract safe water, but you want to make sure that it stays safe all the way to the point where consumers are actually drinking it.
Great, thank you so much. Yep. So I think we're picking them all up now. I can thank you, Bettina. You mentioned it's all the way through to water collection at the say a tap stand, distribution pipe. Thank you to this here. Tap stands, yes, thank you, Nelson. Pipeline, Celio Bay rainwater harvesting. That's number six. So it's every stage. So we may think that our job is done. We've finished the source. I forget the word in English sometimes. The captage and source spring protection. Um, but every element is important. And the container, that's right. Thank you, Edith, the container. So there's a few more. I'm going to jump ahead and reveal those. So there are these 13. Now, with the time we have today, we really want you to come with questions. Um, so, yes, we have some stimulus to create some discussion, but we'd like you to think through any questions you have about any of these sanitary inspection forms, anything about the process, because we do have Bettina here with us, and as you can see, she's got lots of experience and know-how, Jessica too, of course, and I think all of us have a good range of knowledge and experience. So want to make sure you've got time for asking your questions. So have a think what questions you have, and you can pop them in the chat. You can write them down and then raise your hand, and we will make sure we go through those before the end of this session. So reminder, chance for asking questions in this drop-in hour. So do type in the chat, note it down, raise your hand, any questions you have as they come. I can see we're getting most of these now. Number 10, the tap stand. What did nobody pick up on? Jessica, what did nobody pick up on? What was the one that we didn't think of immediately?
Eventually, I mean, we even got water trucking. That's pretty
We
good.
did. Oh, fantastic. Where's that? I missed that. Oh, Francine,
Oh,
thank you.
Francine got it in the chat
Very
right at the
good.
end.
Thank you, Francine. Yes, water trucking. So that's also a key component. We've got a question come up from Edith, which links back to what you were saying, Bettina, which is how feasible is it to do a sanitary inspection at the household level? So number 13, I think you're referring to, going into someone's home. How do we manage that? What's your recommendations or guidance on that part? Number 13. Thank you.
Yeah, I'm not entirely sure what the question is aiming at, but I'll try to answer it, and you can let me
Would you,
know
Edith, if
if
you'd
it
like to
fully
unmute and
answers the
speak to
question.
clarify your question, you're very welcome.
Thank you. Thank you, Bettin. I think the question was just to ask how sanitary inspection would be feasible. For example, I'm working for a World Vision that we work on construction of water supply systems, but it would be a bit not feasible for us to go to each household to also see how water is stored and so forth. And at some extent, there might be some, the main source of water contamination. When you have managed to control contamination at different levels of the water supply system, but when it comes to households, it might be difficult. I wanted just to hear from you what would be recommending. Thank you. Over.
Yes, okay, thanks a lot. That makes it clear. I think the key is that the sanitary inspections do not all have to be done by a single person or a very small team of people all the time. I think what would be very helpful in this case is to also do some capacity building with the community, with the population that's served by the systems. And if they practice household storage, to inform them what safe household storage looks like, to also introduce them to the fact sheets showing what risk factors to look for. And I think experience has shown that it's also very helpful to include schools and kindergartens, because children are often very open to this topic. And if they come home and tell their parents what they've just learned and how important it is for their own health to have safe practices in the home, then that's a very good door opener. So I think the key would be to not look too strictly into how feasible it is for you or your team to do the sanitary inspections all the time at all levels, but also how to involve the community and other people who couldn't support this and who are always at home using the water, storing the water, etc., who would be in a much better position to regularly look after the safe practices.
Thank you, Bettina. And is it sort of, okay, maybe as a team, it's helpful to start a project, say, including this in your assessments to get to understand what practices people are employing for water storage and use in the home, and that then might influence the messages you want to promote as part of your wider, perhaps hygiene promotion work that you're involved in.
I think that's a very good point. It's always a question also how happy people are to let you into their homes. So maybe if you have a team of people also from the area you're looking at, maybe those people who are both on the team but also in the community that's supplied. Maybe that would be a good starting point in order to actually get into the places and have a look at the practices. And yeah, to try and gather as much information at the outset as you can, of course.
Thank you, Bettina. Very good point, Bettina, that you raised. So I think whenever we're doing anything with anybody we're looking to serve, we need to make sure we have informed consent to any observation or assessment or survey where we explain why are we collecting this data, what is it for, how will we use it, and people can always decline to be involved, of course. So just a reminder, great opportunity with Bettina here on the call to ask any burning questions you had on any of these sanitary inspections, sanitary surveys. Abdurrahman, welcome to the call. If you have a question, please feel free to ask or think and note it down to bring to us later. So these are the 13 sanitary inspection forms that WH have created for us to use as templates. Aha, good. Another question. Thank you, Edith. How often do we do sanitary inspections? How often? Does anyone else like to answer this question in the group? Any thoughts from anybody else? How often would you do these? Any thoughts in the group before we jump to Bettina or Jessica? Was anyone like to respond to Edith's question? How often is it done? How often should we do them? If you think you've got a response to Edith, please do respond in the chat or raise your hand. Yes, Onesmus, I can see your hand raised. If you'd like to speak, please do activate your microphone.
I think it depends with the water, the distribution system. If the system is very big, a lot of work is taken into consideration in doing these essays. So probably twice a year if it's a big system. For a small system, it will be easy to do them frequently. That's what I think.
Thank you, Onesmus. Yes, good point. So Bettina, if you want to add, please do. But yeah, I hear that the size, the scale of the system will dictate how often you can visit every site. And you're saying perhaps if you can do it twice a year, that's already a good start. But perhaps even once a year is also a really good start. Bettina, do you want to add into what Onesmus shared?
Yeah, again, of course, it depends. There's minimum frequencies that WHO is recommending in their guidelines for small water supplies for sanitary inspections, and they differentiate between household managed systems where it's recommended to undertake an SI each time water quality testing is done. And there's recommendations on those frequencies as well. There's also recommendations on how often to do it in community managed supplies. So that's about every 3 to 5 years. That's for external assessment. And there's a recommendation for professionally managed water supplies, where it can be part of a water safety plan audit every 2 to 3 years. That's the recommendations for the external assessments, but of course the operators of the systems, they can do it as often as possible because they are more regularly, more frequently on site. And of course, for people who are practicing household storage, ideally, if they've done the sanitary inspections a few times, then they know what to look for every single day to see whether the lid is on the container, etc., etc. So I think also the more often you do the sanitary inspections, the more it becomes part of your system that you already know what to look for without necessarily going through the questions every single time.
That's right. So perhaps over time, you can spend less time doing the inspections because you've honed in on the key risk factors for those sites and it becomes quicker over time. Good reminder. Nelson, thank you. You've suggested and asked really, how can we integrate doing these sanitary inspections, which we can see them as paper forms here, but in digital ways. So using M-Water, and perhaps that can help us map and visualize. Would anyone like to share from their experiences of doing that? Has anybody here got experience of using something like M-Water to manage the data collected from these sanitary inspections and talk about what helps, what advantages that give, or what risk could that, are there disadvantages to going down a digital route rather than a paper-based form? So what are the pros and cons of using digital collection like M-Water? If anyone has an experience, please do respond in the chat or raise your hand to speak. Or Bettina, if you want to jump in, that'd be great. Or Jessica.
Unfortunately, I don't think there's another yet available form of having exactly these forms in digital format,
Okay.
but I do agree it's a great idea, but I think it's something that develops step by step.
Great. So, Bettina, if we understand correctly, an M-Water form for these 13 inspection forms doesn't exist right now, but it's something perhaps to think about. Yes, Bettina.
I'm not 100% sure, but I think
Okay.
it
Well,
doesn't exist yet.
perhaps we can come back to your comment, Nelson, after this
So
call, or
I believe it was just recently released in M-Water.
great.
Perfect.
Hot off the press.
But yes, so they're very new in M-Water. So there's likely not a lot of people with experience who have been using them because I believe they've just loaded all of these particular forms into the
Great.
platform.
Thank you, Jessica. Salio Bay confirmed they are there. The M-Water surveys are there. And Napoleon, thank you. You suggest that an advantage of using M-Water digital forms that means other stakeholders get to know what's happening with the system, perhaps quite quickly, if it's in a database or a dashboard or something visible that people can access remotely. And then that helps people to decide what to do, what actions to take. So it can perhaps speed up that process of going to take action. I know in the course, I think the last module is all about taking action with the data that we collect. Super. We have another question, this time from Ascali. How can we reduce the gaps of sanitary inspections happening through inspectors? So, Ascali, would you like to, if you can, would you like to unmute and yeah, bring your question to us. Tell us a bit more about the question you have. So if Ascali, you can activate your microphone, please do. Oh, I can see you hopefully still connected. Yes, Ascali, if you can activate your microphone, you want to ask your question, please do. My understanding is that, so we're saying gaps, perhaps that things that people miss from one inspector to another, maybe. Perhaps that's what you're referring to. Bettina or Jessica, what are your thoughts?
Maybe I can start and then Jessica add, of course, anything you would like. I think that's a great question because, of course, the inspection is always just as good as the person conducting it. I think training is key, and also having sessions where those sanitary inspections are done together as a group in order to actually see where the assessments might differ and to also take on board the different views because maybe the questions are phrased in a way that may be misleading for some people. So to really also reach consensus of what the questions are about and not just do this once, but repeat this exercise ideally in order to have continually good and thorough results.
Super, thank you. Yes, so like you say, Bettina, having kind of at the start, whoever's involved in doing these sanitary inspections, if you can bring people together to do some practical training where you can perhaps arrive at some common understanding of what you think a crack is and what a crack isn't, that can help bring some consistency to the inspections. I hope that answers your question, Ascali. Elvis, thank you for joining. You've added a comment there that you're keen to understand how these sanitary inspections can help you identify the risks associated to contamination from potentially harmful materials that are used in the pipe fittings, in the storage components. So yeah, Bettina, Jessica, are you aware of to what extent does this sort of maybe heavy metal contamination get picked up through sanitary inspections, or is this more for water quality testing that this needs to be brought in?
I actually think it's not the main focus of the sanitary inspections because it's also so different what different countries require when it comes to those materials in contact with drinking water. There may be accredited materials, etc. So it's not the main focus, but I totally agree it's a very important aspect. And if there is anything that is relevant in your specific context that you're working in, it might also be a good idea to come up, for example, with a list of what are materials that may be used in this context and what are banned materials and how to spot them. But I think the general sanitary inspections rather look at the condition and not so much at very specific single materials.
Thank you. So yes, from what I understand, Benina, perhaps the sanitary inspection isn't the best tool for assessing the risks due to the materials that are used in pipeworks and fittings. But I guess perhaps once you're looking at a supply system, being aware of what materials are in the system are used. I know actually recently, when I was living in London, we had to have the short pipe that connects the main to the house changed out because it was made from iron, I think. So yes, it definitely is an issue around the globe. Thank you. I can see we've got a response from, hang on, Temois. Thank you. Right. So perhaps what I think what you're suggesting, Temois, is that we each have different expertise that we bring. So the team who are doing those inspections, if you can have people who have different backgrounds, maybe one who's familiar with contamination pathways of microbes and others who are familiar with the behaviors and the practices that can lead to contamination and working together on the assessment, the inspections, or at least perhaps, thank you, term Dem one. Dem one. Okay, thank you, Dem one, for clarifying. Yes, so having different disciplines can really help make sure we pick up on those different potential contamination pathways. Um, great. Any other kind of burning questions on the process of using sanitary inspections? I don't know if anyone's had a chance to look at the assignment for Makira, the village, fictitious village. I did search, I did Google Makira, I couldn't find it anywhere, it doesn't exist. But very relevant, I think. So I was going through the forum and noticed some common challenges being kind of popped up, and I had a question as well for you, Bettina. So what are the common challenges? So here's kind of the question I think we can move into. We're talking about it already, but what challenges may we encounter when conducting sanitary inspections? Oh, great. So Bellis has just jumped in to say they have a question about the apron. Check if the so we can go back to that one. So let's see. I think the sanitary inspection we were looking at. Here we go. So Bellis, you were wondering the apron to check if it's well compacted. Is that part of the sanitary inspection? Let's have a look. So it might be a bit small if you're joining your side or on a phone. We've got, is the apron around the wall absent or in poor condition? So this could happen if the apron is, this is number 5, if the apron is damaged, there are gaps and deep cracks, or erosion under the apron that may also allow contaminated surface water to enter the well. So, but I don't know if that responds to your comment. What do you think, Jessica? Do you think this includes how well compacted the apron is. I guess that's part of its structural integrity, I imagine.
So, not being admittedly an expert on apron construction, my my thoughts
Sorry
would
to put you on
be
the spot.
yes. No, it's okay. I was also I'm about to link the M Water page because I noticed we had a question on that.
Ah,
So that's
fantastic.
coming soon. But
Thank
yes,
you.
so I my understanding would be that the compacting of it has to do with the erosion or the prevention of the erosion. So if we're looking at that apron and looking at how well does the soil around the apron look to prevent contamination, then yes, I'm assuming that we're looking for well compacted, non-eroded soil.
Great. And thank you, Jessica. And so I've got a question off the back of that. So if we're doing an inspection and we're not sure if it's an issue, if it's a risk or not, we're not sure if it's really an issue that's going to lead to a poor condition. I'm going to ask everybody first, what do we do? What do we fill in? We've got the option of nah, which I think is not applicable. Is that right? NA.
Mhm.
Yeah,
And then we've got,
absolutely.
thank you. And then we've got no, and then we've got yes. So here's a question for us all. What would you do if you weren't sure if it was a risk? So, for example, in Benis's case, you're not sure if the apron is well compacted, well confitted, if it's not compacted well enough, or you're not sure it will lead to a risk. It could be a risk, but you're not sure. How do you fill in the form? Which option do you choose? Have a think, type in the chat, unmute and speak. How would you fill in the form if you were unsure if the description here is present or not? So, for example, so maybe if we're not, yes.
Can I come in?
Hi, is that Mohammed or Mama? Just trying to capture who that is. Or Charles, is that Charles? I'm not hearing you. So if you want to try again or type in the chat, please do. Elvis is going yes, that we should mark it as a risk factor. And as you can see, if you scroll up, Jessica's posted the page on sanitary inspections for M Water. Thank you, Jessica. Aha, Nelson thinks no. So we've got two contrasting options. If we're not sure if it's a risk factor, do we say yes or do we say no? So if we say yes, what does that mean? So if we're not sure, what are the implications of putting yes? What does that result in if we have yes? Maybe if we're very unsure, we might say, oh, I think so, I'm not sure, I'm not sure, I'm not sure, and we put yes for lots. So that's one option. And the other option is if we say no when we're unsure, oh, I don't think that's a risk. Nah, that's sanitation infrastructure toilets. I don't think that's a risk. From what I can see here, I don't see that being a risk. I'm not going to check. I don't think it will be a risk. What are the implications of saying yes? And what are the implications of saying no if we're unsure? If we're unsure. So Nelson, you said no. Elvis, you said yes. Would either of you like to unmute and say why you've gone for your yes or why you've gone for your no? Nelson or Elvis, if you'd like to explain or talk of why you've put yes and why you've put no. Anyone else, please do type in the chat or raise your hand to speak. Because I appreciate when we come to fill these in. Yes, Mohammed, did you want to highlight perhaps one of the answers? Napoleon will also say yes. So we've got two in the yes camp, one in the no camp. Bettina, if we say yes when we're not sure, what what consequences does that have for our sanitary inspection? If we're not sure and we say yes.
Well, if we're not sure and we say yes, but
Hello?
it is
Or
not a
Oh, hi
risk
there.
factor.
Oh, Sorry to cut you in, Bettina. We had
Yeah,
someone
no,
else
no worries.
also chiming in, which is great. Hi, who?
Yeah, hello.
Hi, I can hear you.
Yeah, so sorry to interrupt. This Elvis. I
Oh,
just
hi,
wanted
Elvis.
to, yeah, I wanted to give a reason why I chose yes. Yeah, so I mean, my reason is that I mean, reviewing the cause, I've realized that the WHO framework in itself is risk-based and it's kind of like, I mean, precautionary in nature. So I am doing an SI and I realized that I'm unable to identify whether, I mean, it's really risk or not. I mean, what I would go for is, I mean, a yes, so that even if at all, in the event that probably there's a joint evaluation and it comes out that it's not actually a risk, I mean, it is fine. However, if you leave it as a no, and then in the event that you do a joint evaluation, then you come to realize that it's a risk, you may have already exposed the users of the system to, I mean, harm. So in order to prevent this, you are not too sure. Not being too sure here also, I mean, means that there is insufficient assurance, I mean, quality assurance of the entire system. So the moment you realize that you are not too sure as to how to classify whether it's a risk or not, for me, I would just prefer that you go for, I mean, the yes, so that you're able to prevent unforeseen circumstances. Because this is like kind of, I mean, supposed to be a preventive measure. Yes, and I mean, kind of and precautionary to in nature. So that's why I went for yes. Thank you very much.
Thank you so much. Right, so yes, Bettina, do you want to carry on what you were saying? And I think, thank you, Elvis, you were saying that if you're unsure, it's better say yes in case it is an issue. And maybe as you do another visit with other people, that will help confirm whether it is an issue or not. Bettina, do you want to add to those comments?
Yes. I mean, if you put yes for a risk factor and then it turns out it isn't, then what could happen is that you use resources to repair something that does not necessarily need to be repaired. However, if you take no and it actually is a risk factor, then you miss the opportunity to take action to actually remediate that. So I think what would be an option is to tick yes and then put in the explanation that this question in the sanitary inspection form is about the structural integrity of the apron, and that from your point of view, this is not given if it's not compacted enough. So there's always the comment section that you can use. And what you can also do if the question shows unclarity for you, it's not clear whether this is covered or not, you can always get back to whoever you received this sanitary inspection form from in order to clarify, because maybe others have this question mark as well and do not know how to properly answer this question, so that in a revision, the phrasing, the wording could be made clearer.
Yeah, so there are consequences for either option. And like you say, if we say yes and we do something, but it wasn't an issue, then if we've got limited resources, perhaps we've not used our resources as effectively as possible. But if we're not sure uh, and we say no, we might be missing something that can lead to contamination. And like we say, we can make notes, we can go back, and we can do checks. I can see, thank you, Dem Dem one, Dem one in the chat. Um, Also recognizing that it might come at a cost if the risk was not there because you're spending money or resources on doing something that you don't need to do. Um, and if it's no, then you put no. It turns out to be a big risk, then you are putting people's health at risk. We've only got 5 minutes left. I feel like we've got lots more questions, so please do um, join in if you've got more. And this question made me think of the case study. So in the case study, if you had a chance to have a look at it already, do encourage you to go into the case study. There's an assignment under Unit 1 for this fictitious Makira where they've started going about doing, that they've been spending a lot of money reacting to problems. So they spent money on repairs, on increasing the chlorine dosing when there's contamination. And we've asked you, well, would it be better to use a preventative approach using sanitary inspections? I think most of us are saying, yes, there's definitely good value in that. But you've noticed an issue, many people have raised it, that the community may need some convincing that it's worth doing this preventative work because it might seem invisible. They might, I think people in the discussion forum were saying, well, communities, they might see a broken hand pump or a contamination that's repaired or resolved, gives people can see the value in that, but value in something which is a form checking where there doesn't seem to be an issue, people might need some convincing. So my last question for us was to take that question from the forum. How do we convince the community it's worth conducting sanitary surveys on a regular basis? How do we convince people in the value of shifting towards this preventative approach? So if anybody has any thoughts, please do respond. So what would you say to the community? What arguments would you give to the community if you had to advocate for doing sanitary inspections, spending time, money on these, the training that's required, rather than just fixing things when they go wrong? What would you say? What argument would you bring? And Jessica and Bettina, I will come to you afterwards as well, but want to see what people think. There was some great discussion in the forum, I know, in groups 1 and 2 on this. So for those groups, to encourage you to look in. But any thoughts from the group? How would you convince a management committee or a community to shift towards preventative action? Feel free to raise your hand and unmute or respond in the chat. I appreciate we're just approaching the hour, so perhaps some of you have to go off to another call or you have other commitments, not a problem. I hope you can still hear me.
Hi, it's
Yes.
Manuel here.
Oh, hi, Manuel.
Yes, I think the key issue is maybe to use the data that you have collected that is evidence-based and indicate the risks that would be incurred if no action is taken to correct the issues that we identified. I think that's my take on that. Just to present the evidence that we have done some groundwork, and this is what is coming up, and these are the corrective measures that need to be done. Yeah, thanks.
Thank you, Manuel. Manuel, are you calling in from South Africa? Is that correct?
Yes, I'm calling from South Africa.
Fantastic.
Yeah, thanks.
So yes, so you're highlighting that what's important is that transparency to the community. So if you're working with the management committee and they've made a start on doing sanitary inspections, being able to demonstrate to end users, well, this is what we've noticed. We've noticed these risk factors. We've taken these actions. And as a result, we can show that there isn't contamination and providing that evidence so that people can see what you're doing and appreciate that, they are responding to things, even though it doesn't seem like it, if it doesn't seem immediately visible, because not seeing things that are broken down being repaired. And Charles, thank you. You've typed in the chat to highlight the risks of disease spreading and the high medical costs that come with that, and at worse, the loss of life. So yes, important to highlight the benefits that a preventative approach can take to safeguarding health and the costs associated to that. Bettina, would you like to add anything to this question about how do we convince people the value in shifting towards a preventative approach?
If it's about convincing the community, I think another important aspect is ownership, because they can take act to make their own water supply or the water supply in their community safer by investing just some time in the beginning and not a lot of other resources, but having a valuable contribution nevertheless to make the water supply safer. So it's a great tool, I think, also because everybody can do it. You don't need extensive training necessarily, but you can already contribute to sanitary inspections without any previous extensive training or any laboratory costs or something. It's such a low investment for potentially such a high and valuable output that I think that's a great argument to do it.
Thank you, Bettina. It makes me think of a graphic that I've seen where I think it's a table. I think on the bottom you have like the cost of doing something, and then the other side you've got the other axis, you've got the benefits of doing it, something like that. Maybe it's the other way around. So when you've got that box of high benefits and low cost, if you can demonstrate, well, we're doing all of these things to, if we go back to the form, let me have a look. It's helpful to see these examples. Um, we're improving the drainage because it's low cost, but that's going to have a high impact. We could put a fence in, which is relatively low cost, but it's going to have a high impact of preventing, say, animals getting into near to where the water point is. So yes, taking that approach of demonstrating the benefits over small effort. Um, great. I think we've come to the hour. I have a bit of capacity to stay on the call. My screen might be frozen, so I can't quite tell who's still on the call. But if you've got questions still, I'm happy to stay on the call. Bettina, Jessica, if you have capacity, can you carry on or
Yeah, I've got a couple of minutes.
a couple of minutes? Great. So a few more minutes with Bettina. Any final questions for Bettina? Any final questions? I did have some quiz questions as well. But want to give you guys a chance to, anything else you've been thinking about that's maybe come up as we've gone through this call, or anything else you're asking about sanitary inspections. Oh, I have one question actually. I think we've kind of answered it as we've gone through. But so we're talking about a sanitary inspection being about identifying risk factors. So you can see here risk factors, a toilet close by, um, an animal that's got inside. Well, what do we do once we've identified these risk factors? So we filled in our form. We said yes, 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 no, no, no. We've got a number. Um, what do we do once we've identified these risk factors? That's my final question for us. If anyone would like to jump in and respond, what do we do? And then if you're still on the call, but I'll come to you, but I'm keen to, what do you guys think? Imagine you've completed the forms with your team, or if you've received a whole load of forms. What do you do next once you've identified the risk factors? Any thoughts? My screen is frozen, so I can't see anyone moving around. So if you want to jump in, please do raise your hand or type in the chat. Great, thank you. I can see in the chat, Ayempere, we take action of correction. We take action. That's right. So I'll pop up. I think this description comes from the guidelines. Bettina, would you have anything else to add to that? And I can see we've got taking action, corrective action, but there's also that ongoing monitoring. Yes, that's right. Thank you, Francine. There's immediate actions that we can take. And
Yes,
Francine, oh yes, Bettina, sorry, carry on. Yeah.
yes, the sanitary inspection forms already come with some recommendations of what action can be taken if this particular risk factor is identified. So you don't have to start from scratch, but there is already some guidance in there how you can improve the situations if there's any risk factors present in your supply. But yes, you don't just stop at identifying, oh, there's a risk, but you do take action in order to mitigate this risk and make your supply safer again.
I
Thank
want
you,
to
Bettina.
highlight, sorry, I'm just going to
Yes,
highlight what
Jessica. Please
Napoleon
do.
said as well, because he said he would check to see if there are already systems in place to prevent those hazards and if those systems are working as they should. So checking for any existing control measures that might be in place and seeing if they're working, because identifying those risks may mean that those existing systems aren't working as they should.
Excellent point. Thank you, Napoleon. That's right. Perhaps there were systems in place for checking, but they've not done their job well enough, and it's good to find out what inspections had already been going on exactly.
And there's another comment in the chat from Onesmos saying, come up with priority list and then take corrective action. And I think this prioritization is also an important point if you have several risk factors and several actions you want to take, that it's good to prioritize what's most important and then take the action step by step.
That's right. So prioritizing what we want to do right away, and like we say, talking about, well, what's the cost involved? If it's low cost and high benefit, we focus on those actions first. Great. We've gone over the hour, Bettina, if you need to sign off, and please do. Thank you so much for being available. Great to have your insights as we explore sanitary inspections. The next session. So now we are still in week 2. So if you're already working through the self-study, do try and complete Unit 2A this week and then move on to Unit 2B, where we'll be looking at sanitary inspection programs, so the kind of wider issues of how we organize and manage using sanitary inspections. Bettina, will you be here with us as well next week?
Yes, I'll be there next week.
Fantastic. Thank you so much, Bettina, for being here with us. I'm happy to stay on if there are any other questions. I do encourage you to check out the assignment. If there are questions, please do just raise your hand, type in the chat. If you do have capacity and you want to stay on, we could even do a little practice sanitary inspection for one of these yellow numbers, but we are already beyond the hour, so if you have questions, I'll stay on the call. Bettina, feel free to log off. Thank you again for being available.
Yeah, let's see if there's any questions. So, as I say, I've got a few more moments.
Okay, fantastic.
Happy to be here for any questions that may come up.
Thank you, Tim. What? Tim 1? Tim 1? Tim 1. Thank you. Yeah, so if you do have questions, please do jump in. Thank you, Jessica, for joining. Thanks for your contributions and making sure we saw the questions coming up and the responses in the chat. We'll have this recording saved, so if you want to watch back anything, I think, Linda, you said that you had dropped off the call and were asking whether that question about household storage had been answered. I think it had, so you can watch that back. Do encourage you to engage in the forum, the assignments. Do have a look at the posts that other people put. Sometimes you'll find that other people have similar issues or similar thoughts, and together you can share ideas of how to use what you're learning in your work more effectively. But we will be back next week. If there are any questions, stay on the call. Or if you just want to have a go with a sanitary inspection, a virtual one, I'm happy to talk through some for anyone who has interest and capacity. But if not, you can sign off. I think I end the call when it happens. Great, no questions. Well, I can see lots of people logged in. So I'll give a couple of minutes. But if there are no questions, we have come to the end of the session. Thank you. Great. Well, thank you for your contributions. Any questions that you have after this call, don't hesitate to put them in the Q&A section of the course, which I think I can just pop up. Yeah, so we've got in the course, you can add questions to question and answers, and one of us will respond once we see it. I do encourage you to go through the assignment and do post in your respective forum with your summary thoughts on the assignment. And you'll see there's also one for 2A as you go into this. So yeah, the 2A one, here we go. That's the next one to do. And just as a reminder, some people are asking you must download the PDF for any changes to be registered. So if you were to type in here, you need to do it in the version that you've downloaded offline. Great. I think people might be waiting for me to end the call. So last couple of minutes. If not, thank you so much. Great. So we've just come to the end of our call. If you joined late and want to watch back, you can. The recording will be made available soon, but if not, wish you well for the rest of the day and look forward to seeing your comments in the forums and joining you again next week to explore the next part of Unit 2, which is all about the bigger picture of how do we go about managing and organizing sanitary inspections at a wider scale for an entire system. Here we've been focusing on how do we use them for one bit of infrastructure at a time. Next week, we're looking at the bigger picture. So do join us. Thank you, Wilson. Thank you, everybody. Bye.
Thanks a lot. Bye.
Thank you. Bye-bye.